This is always the holy grail. Can we find, what can we predict? Imaging biomarkers that can predict the disability progression or the future worsening of MS patients. And this is a very hot topic at previous and current and I'm sure future American Academy meetings. One of the main biomarkers that we're looking at right now in transition to progressive multiple sclerosis or worsening of the disease, we are using a PET-based, this is positron emission tomography-based imaging, where we try to track the activity of microglia. And we're doing that by using a radiotracer. This is a radioactive molecule that has tendency to bind to active microglia called PBR06. And using this PET technique, we're trying to determine how much of activity microglia has. And then we can use that biomarker to determine are drugs helping in reducing the microglia activity, which we believe are the reason for this long-term insidious progression in multiple sclerosis patients. So we definitely see that the medications that we have currently available for multiple sclerosis are very good at stopping the relapses, stopping appearance of new lesions, new gadolinium-enhancing lesions. However, we really do not have a good measure of what happens in this secondary progressive phase of multiple sclerosis. Basically, we have a system which is self-sufficient within the brain that is not communicating with the periphery and the peripheral aspects of the immune system. So definitely we have to focus a little bit more on finding biomarkers, finding ways how we can either target this self-sustained immune system within the brain and how we can image that. One way to do it is using leptomeningeal contrast enhancement. These are tertiary follicles in the meninges that we believe are responsible for this insidious continuous inflammation that we are not able to record with regular imaging or regular clinical aspects of multiple sclerosis. So by imaging this leptomeningeal enhancements, and we can see if medications actually decrease them in number and in size, maybe potentially a way how we can use that to track the activity of medications and which medications are effective or non-effective.